Terrific. Good morning, everyone. Thank you so much for joining us for our latest media briefing on important healthcare issues in the news. I'm Dr. Adam Kassam. I'm a physiatrist in Toronto focused on musculoskeletal and neurological rehabilitation. And I'm also the president of the Ontario Medical Association, which represents more than 43,000 doctors and medical students. Now, it's been almost 2 years since China began reporting cases of the mysterious virus that would come to be known as COVID-19. And our lives were changed in ways we couldn't have ever imagined almost since the World Health Organization declared a pandemic on March 11, 2020. Working from home, wearing masks, hand washing, social distancing, fist bumps instead of handshaking, vaccine certificates to get into public places, curbs on travel, online workouts, online shopping, debit instead of cash, smaller gatherings, including at weddings and funerals. And as we enter year 3, we aren't locked down. We have vaccines and our vaccination rates are high. Children are back in school and they too are getting inoculated. We can see family and friends again, although in small, safe gatherings. We can travel, although public health officials recommend that we stay within Canada. And we are enjoying concerts, theater, and professional sports in person again with proof of vaccination. But infection rates are on the rise, primarily in Ontario and Quebec, and we are dealing with yet another new variant, Omicron. Scientists are still assessing how it will behave, and already public health officials here in Ontario are warning it will become a dominant strain very soon. Pandemic fatigue is peaking, and it feels as though we are bracing for more of what we have already been through. And that's difficult, and we're uneasy. And we want to know what's ahead. So what can we expect as we enter our 3rd year? Well, the waves of infection continue. What do we know about Omicron, and how can we best protect ourselves? What will the new normal look like, and what are the things that we will never do again and things that we will always do differently as we learn to adapt to a virus that isn't going away for good? What has been the effect on children, and what can we do to help them adjust to this new world that we're all navigating together? In order to help us gather some perspective, I'd like to introduce our 3 esteemed guests today who in a moment will give us their perspectives on how to prepare for our 3rd pandemic year. Dr. Allison McGeer is a professor in laboratory medicine and pathobiology at the Dalla Lana School of Public Health at the University of Toronto. She's also an infectious disease specialist and senior clinician scientist at the Lunenfeld-Tanenbaum Research Institute of the Sinai Health System in Toronto. Dr. Ripudan Minhas is a developmental pediatrician at the Women's and Children's Health Program at St. Michael's Hospital and an assistant professor in the Department of Pediatrics at the University of Toronto. And Dr. Onil Bhattacharyya is a family physician at Women's College Hospital and director of the Institute of Health System Solutions and Virtual Care. Dr. McGeer, will you please start by telling us what we can expect from the COVID-19 virus and its new variant, or is it really too soon to tell? Oh, you're on mute, Allison.
Okay, first of the day, but it won't be the last. So every day we're learning more about Omicron. A couple of new reports even this morning out about what's going on with it. But the summary of it is that this is really bad news for us at this time. Omicron moves faster than other variants, and the pace of it we're leading in Ontario is accelerating very quickly. We're on track to have 5,000 or 6,000 cases at the end of the month, which is much faster than other variants have taken over. And so what that means for the beginning of 2022 is some very difficult decisions and some difficult times. There is good news out of South Africa this morning. That the variant appears to be a little less severe, but we're talking about a 29% reduction, which is, it's good news, okay, but it's not good enough news to preserve us. And it's also true that we know that vaccine protection is significant, okay, not as good as against previous, but it looks like with 2 doses of the mRNA vaccines, protection is 30 to 40%, and everybody's going to look and say, oh, that's terrible, okay? But the truth is that if that was all we had, we'd say it was brilliant. So, it's still really useful. And it looks like the 3rd dose is going to be more protective. So there's no question that we are facing a really discouraging and depressing and difficult time for the next month. We need in order to buy us time to get third doses into people, we're going to need additional public health restrictions. And that's obviously going to need to be accompanied by support for the people who are going to suffer from those restrictions. If we choose not to do that, then we're looking at a healthcare system that is going to be overwhelmed in sometime in early to mid-January. And so we're now on that very difficult balancing act of, we want the minimum number of restrictions, but we know that we're going to be in trouble if we don't put them in. And remember always that the time from transmission of the variant to occupation of the ICU is about 3.5 weeks. So what's happening, what we do today is what tells us what ICU occupancy is going to be 3 weeks from now. And what that tells you with the speed Omicron is moving is that we have very little time to put these restrictions in order to preserve our ICU capacity and our ability to care for people in the healthcare system in Ontario. So short term, this is a lot of work and a significant setback. Long term, however, okay, it's just a bump in the road. Okay, we can get through this. We know third doses of vaccine are going to work. However hard this is, we've done it before. We can manage it again in the short term, and we will come out the other side of it later on in 2022. And you know, this pandemic is still going to end. We're still going to get through it. It's just longer and more difficult than we were hoping it was going to be.
Yeah, thanks so much, Dr. McGeer. I think it's very important to highlight that, you know, positive messaging moving forward is going to be extremely important for the public, for all of our neighbors and our communities to really understand how we move forward over the coming months. I think we are fundamentally in a different place than we were a year ago. We have the vaccine, we have therapeutics, we have a better understanding of the disease and its transmission. We have gone through some of the public health changes that we've all sort of been subject to. So I think that there is a fundamental change that has happened about a year, you know, over the course of the past year, and that should give us some confidence about being able to react and respond moving forward. Dr. Minhas, you study the development and behavior of children, and we know that the pandemic has had lasting effects on our youngest family members. What can we do to help them do well in this state of new normal?
Thanks, Dr. Kassam. Yeah, it's really a tricky time. So over the last 21 months, I've had the opportunity to work closely with a range of children, youth, and families who've struggled really with the pandemic's devastating non-infectious repercussions. So I was hoping over the next few minutes to share some of the experiences of my patient families who've given permission to share in this forum. And I hope that this serves to underscore really the detrimental work that lays ahead of us as we continue to navigate through this pandemic's really uncertain waves and consider what's needed to support children and youth in a post-pandemic world. So maybe first I'll mention my patient OF, who's a 15-year-old boy with a diagnosis of attention deficit hyperactivity disorder and obesity. He lives with a parent with diabetes and hypertension. And since spring of 2019, since the beginning of the pandemic, O has not returned to in-person learning due to the family's worries about catching COVID-19 at school and transmitting it to his high-risk parent. He struggled with online learning to be able to sustain attention and to retain information. And his mother feels unable to support him with schoolwork due to her own learning limitations and mental health challenges as well. And his learning gaps have widened, and he worries about whether he'll have the grades to get into college as he had hoped. And you know, the impact of school disruptions on Ontario students has not yet been fully evaluated, and that's something that's in the works right now. In the US and the UK, researchers have recorded significant impacts of school closures on academic performance, and we know that longer closures result in larger learning losses as well, even with virtual learning in place. And I've certainly seen this in my clinics, and we're seeing what we're calling the pandemic pause in children's developmental progress, including aspects of their socialization, their communication, and academics. And the schools that I work with are struggling with also the well-being and availability of teachers, educational assistants, and child and youth workers also. So really, for meaningful recovery from a school standpoint, I think we really do need increased funding for struggling students to have access to special education resources, support for teachers and educational assistants, and smaller class sizes. And of course, we also know that schools are so much more than classrooms and desks alone. They're a place for students to connect with peers, with mentors, to feel safe, to access healthy meals, to be active, to explore interests. to define their identities and to feel a part of a community. And this has really been fragmented for many students, with a disproportionate toll we know on students from vulnerable backgrounds as well. So another patient, RK, is a 7-year-old grade 1 student with autism spectrum disorder and language impairment. And we saw that his carefully cultivated educational and therapeutic program really fell to pieces when schools closed during his JK year. And we know that for many students with special education requirements or learning exceptionalities, schools are a place to access vital time-sensitive therapies like speech, behavior therapy, occupational therapy, and physiotherapy as well. And so when we consider school closures, I think special education classrooms really should be the last to close and the first to open. And now, as Dr. McGeer was saying, as we're grappling with Omicron and increasing COVID-19 case counts, I hope that we'll do everything possible to keep schools safely open for all of our students. And in addition to the physical health piece, I think also we need to keep in mind for our children, youth, and communities, the resultant toll on their mental health as well. My patient CL is a 12-year-old girl with anxiety who's had multiple emergency visits during the pandemic related to decompensation in her mental health. She's been unable to participate in restorative activities like dance class, meeting with friends, or summer camp during long stretches of the pandemic. And during the pandemic, I've really been urging families to see their healthcare team or their mental health professional if they see changes in their child or youth's behavior, including ongoing low mood, changes in appetite or sleep, or unusual or self-harming behaviors. And in clinic, I've been trying to suggest that all families really try to make space for their children's feelings at home and also their own, and to model as possible adaptive self-regulation strategies. As you may know, many studies are showing, or some studies are showing, that more than 2/3 of caregivers have described a decline in their child's mental health during the pandemic. And we're seeing huge numbers of referrals for urgent psychiatric consultations, eating disorders, and ballooning wait lists for developmental assessments across the country. Families really need timely access to care, but instead they're being confronted with lengthy wait lists. And I'll also mention, as a pediatrician, I'm also aware of the mental health burden of the pandemic on parents and caregivers who've been unable to readily access their supports, ranging from postpartum mental health groups to respite groups for caregivers of children with developmental disabilities. Caregivers have shared with me their struggles of trying to raise their families in isolation, while the pandemic has dismantled their rich, supportive parenting communities comprised of grandparents, aunts, uncles, neighbors, and community members. We've also seen increased referrals for child protective services during the pandemic, with increasing concerns for child maltreatment, abuse, and neglect. And we know families are struggling and need support through the community, through community-based, culturally sensitive programs that support parental mental health as a key determinant of children's physical, mental, and developmental health as well. And lastly, I'll mention also, we're also beginning to see referrals for toddlers like my little patient JT, who's an 18-month-old girl with speech delay. She was born during the pandemic, and her interactions with the outside world have been through a digital screen, a mask, or a distance of 2 meters. And the social landscape is really different right now for children born during the pandemic, with fewer social interactions through play dates and family get-togethers, guarded playground trips, and lower attendance at daycare and early literacy programs. And we know these are all experiences that nourish the developing brain for the first few years of life. And while young brains are incredibly resilient and plastic, we have yet to understand what the toll of this sort of isolation is going to be. We know the most important social relationship in child's early years is really the attachment relationship that they create with their primary caregiver and that person's capacity to provide nurturing and responsive caregiving. New parents really do need access to evidence-based parenting supports and mental health resources to allow them to build strong attachment relationships with their child, especially in this relative isolation that we're feeling in the pandemic as well. And as a part of that, I'd say an important tool will also be publicly funded childcare to support equitable access for early childhood development opportunities, which we know have lifelong and multi-generational impacts. So as I said, the repercussions of the pandemic on children or youth are broad, they're multifaceted. It's important for us to make space in our homes, in our schools, and in our clinics to support their mental health and also their physical, developmental, and academic growth and recovery as well.
Thank you so much, Dr. Minhas. These stories just underscore the enormous impact that COVID-19 has had on children, on our youth, on parents, and on communities. And I think that, as you're very eloquently describing, as we start thinking about the next 2 to 4 to 6 weeks and beyond, we have to take into account the impacts of any of the decisions that we have on the broad, the broad level society challenges that face us now and unfortunately into the future. And it also underscores the importance of redoubling our efforts to ensure that children and youth have access to the proper care that they need at the time that they need it. Dr. Bhattacharya, COVID ain't going away. And we hope that the pandemic will move into an endemic state eventually, and we believe that that will happen. But the virus seems to be sticking around and probably will be with us for some time. So what does that mean for our day-to-day lives, and what do we do, and what should we be doing differently?
Well, the Spanish flu petered out after 2 years, transitioning to a less deadly version like the one we see that circulates around the world today. But there's nothing magic about the 2-year period. And we have a new wave starting on the 2nd anniversary. So like you just said, Adam, we could be doing this for a while. What does it mean? I think it means adjusting to a world where case counts of coronavirus rise and fall based on public health measures, vaccination rates, and the rise of new variants. I think previous waves were managed with a range of ad hoc measures that some felt were too late and some too little too late, others felt were too stringent. Government would propose things and then backtrack when there was too much pushback. So I think what we need is a broader discussion about what is acceptable, what's an acceptable burden of disease, including hospitalizations and ICU bed use, and what are acceptable thresholds for taking action. There's no right answer, but there are acceptable compromises within a society. Our threshold will be lower than the US and the UK, which have tolerated a higher number of cases and deaths, but it might be higher than Australia or Singapore. What measures we take will depend on how we value the well-being of children, of essential workers, and of our economy. It'll depend on the level of surveillance and social control that we are willing to accept in the interest of public health. All of this can be debated and reasonable compromises can be found. Setting thresholds for a series of containment measures and communicating them will make it easier for individuals and industries to plan for a future where our lifestyle changes from month to month and season to season. So practically, what might we see? So I think wearing masks will go from being a marginal to a normal activity, particularly for those with any respiratory symptoms. How we work will depend on our preferences, where people will choose the industry and work arrangements based on how much time they want to spend on site versus at home and how much they want to be exposed to other people. International travel is probably going to become more of a luxury, something we do less often and for longer periods when we do it. The good news is we can appreciate what we have in this huge and beautiful country. But from a healthcare provider, I think the biggest change will be in the delivery, how we deliver care. And here, I think we're going to see much more robust virtual care. Instead of switching from in-person to telephone-based care, we're going to start to think about how digital tools can help patients access advice and for physicians to triage incoming requests, prioritize them, collect the information they need to make a diagnosis, and provide ongoing education and follow-up. These are core functions of outpatient care that actually I think have not been great up to date and could be much stronger than they have been. We've seen remote monitoring greatly expand with the potential to support patient self-management and receiving timely care at a distance. So all of these tools can improve the core functions of healthcare, but will require substantial redesign of workflows to really be effective. At its core, I think there's a sense that no one's safe unless everyone's safe. And that sense may lead to a stronger social safety net. But these are a set of societal choices that we must make together. How we make these choices is essential to recreating the solidarity we saw in the first wave. Either we'll just get used to this, or we'll rise to the occasion and create a new normal where we can thrive instead of just stay alive.
Yeah, thanks so much, Dr. Bhattacharya. And you bring up a lot of good points about the future of work, the future of healthcare, the future of interaction, the future of travel, and what does that look like in a new normal, and how do we as a profession to wrap our hands and arms around appropriateness for virtual care in certain contexts? How do we think about what the future may hold for a number of different industries and the economic impact of, as you're describing, sort of a dimmer switch back and forth with case counts rising and falling? So I think that while there is uncertainty, there has been a tremendous amount of learning that has happened over the past 20 months to hopefully guide what will be a response now, with Omicron and future variants around the world. So first of all, I want to, thank our panelists, Dr. Allison Minhas and Dr. McGeer. We're now going to open up our Q&A session, and Ashley Molnar from the OMA will be moderating this portion of today's briefing. So if you do have a question, please put them in the Q&A function in the chat. And if we don't get to your questions due to time, the media team will follow up with you. Just a reminder that you can also email media@oma.org with additional requests for interviews, and we'll also have a recording of this session available later this afternoon. So with that, I'll hand it over to Ashley.
Thank you very much, Dr. Kassam. Our first question is from, our first question is from Nushin Zafari with the Canadian Press for you, Dr. Kassam. How do you think we should get people to keep up the fight, seeing how the average person seems to be experiencing pandemic fatigue, and tuning out the alarm bells that experts are sounding right now?
It's a really good question. I think we're all fatigued. I said that we were fatigued, 9 or 10 months ago. And so people have, this is just a compounding of that issue. I think just going back to what Dr. McGeer was talking about earlier at the top of the briefing here, we're fundamentally in a different place than we were a year ago. We have vaccines. We see the impact of them on a daily basis. Ontario has been a world leader in terms of vaccine rollout and administration, 90% for first doses and 87% for second doses. These are things that we should be proud of as a community, as an Ontario community. We also know that while we have this challenge with the variant in our midst over the course of the next 4 weeks, we also have to recognize that this is, as Dr. McGeer is saying, just a bump in the road. Sometimes progress can be uneven, and we have seen that back and forth over the past 20 months. I'm focused on optimism. I'm focused on the future. I'm focused on positive messaging. I think that is what we need to shift towards as a society, focusing on some of the unity that we need to build during the holiday periods, and focusing on what will invariably be a better 2022 than a 2021. And so I think that should be part of our messaging for all of us, including family members and neighbors and patients and community members that we interact with on a daily basis. And so positive messaging, I think, would go a long way to framing the conversation right now in a slightly modified approach.
Thank you, Dr. Kassam. Our next question is from Emma Jones with helping.ca for Dr. McGeer. Dr. McGeer, previously there's been conversations about needing to develop a booster shot specifically for the new variants. Is this still seen as a needed response to the latest developments, or is the current version of the mRNA vaccines enough?
So for the first set of variants of concerns right up to Delta, the original vaccine was good enough. People have made Delta and Beta containing vaccines, but they're not better than the original vaccine. So, and the original vaccine is very effective against, everything up to Delta. Now that we have something where the original vaccines appear to be not quite as effective, again, people are scrambling to create a Delta vaccine. That, of course, then has to have some testing associated with it to make sure that it really does work better. We're looking probably at a time frame for the mRNA vaccines of about 4 months from 2 weeks ago, when people started scrambling to get it moving and get the testing done, to when we might have a booster vaccine. In the meantime, very clear that third doses of the original vaccine significantly improve your protection against Omicron. So what we need now is everybody to get their third doses of vaccine to improve their protection. And then we'll see whether a variant vaccine will do better, and whether we need to move to it when they're ready. But yes, people are working hard on it.
Thank you very much. Follow-up question for you as well, Dr. McGeer, from Ray Chan with Singtao Daily. Do we need boosters every year, like the flu shot?
I still don't know. This is a pandemic, and we do it one step at a time. Obviously, we were all really hoping that 2 doses of an mRNA vaccine was going to be the end of the story and protect you. And we've learned that even against Delta, that wanes with 2 doses. So now we're talking about what we call the primary series. Okay, so what you need is, unlike measles, which is 2 doses, is tetanus, which is 3 doses, okay? And it may be that, like flu vaccine, it's going to evolve into something that you have to have every year or 2. Good news is people are testing combination vaccines. So if we are going to have to get an annual vaccine, probably what it's going to be is a combined flu and SARS-CoV-2 vaccine. So it'll still be 1 shot every fall instead of anything worse. But really, we're just going to have to watch and see. It may also be that 3 doses is enough to give us good protection, and we're not going to need another vaccine after this.
Thank you very much. Our next question is from Jack Hahn with Queen's Park Briefing for Dr. Bhattacharya. Am I right to understand that the prediction is public health measures lasting forever, but we have to deal with gathering limits, mandatory masking, etc., every single winter?
No, I would what ultimately what it means is responding to the circumstances. And, when Dr. Kassam was talking about sort of the fatigue, I mean, another way to look at this is a type of self-efficacy, where there are a series of measures that are effective. And as case counts rise, we go from step 1 to step 2 to step 3, knowing that they can actually work. And we've proven that these things work, right? We've gone through a number of phases. So that this will go on indefinitely, I don't think so, actually. I think, as Dr. McGeer has said, we will probably have a mild, either prevalent immunity or a disease that is milder, such that, we don't shut society down for the flu every year, right? So we will probably get there. But in the meantime, what is important is that we have a series of measures that we know, that we accept, and with thresholds, so that we can take action. Because actually, I think we can beat this. We've done it many times, and we are able to do this. It's just hard. And I think sometimes we had a bit of magical thinking that this is just going to go away and it'll be done by now. But I do think we have the skills and we just need to apply them judiciously.
Thank you very much. Our next question is for Dr. McGeer. Would you comment on the study out of South Africa today showing Omicron appears to cause less severe illness than earlier variants, but is more resistant to the Pfizer vaccines? What about those of us who had AstraZeneca or Moderna?
Yeah. So specifically comment about vaccines, what we know about the Pfizer vaccine and Moderna vaccine is that they are very similar. Moderna may be a little bit more effective in frail older adults, but for regular healthy adults, there's not a difference. And you actually don't need to have data on the Moderna vaccine to know that it's going to behave as well as the Pfizer vaccine against Omicron, because it's the same spike protein. We will get Moderna data eventually, but we're not getting it out of South Africa because they haven't been using that vaccine in South Africa. They've only had Pfizer and Janssen. So the same thing applies to the AstraZeneca vaccine. We're expecting that if you've had 2 doses of AstraZeneca and your mRNA third dose, that'll give you roughly the same protection as 3 doses of an mRNA vaccine. But we're going to have to wait for Canadian or UK or Danish data to confirm that for us, absolutely, because South Africa hasn't been using the AstraZeneca vaccine.
Thank you very much. The next question is for Dr. Minhas. What are the signs that kids are struggling?
That's a great question. It's really tricky. I think it depends on the age and stage of the child. Generally, we would be watching for changes in behavior. So if you're seeing changes in their sleep patterns, changes in their appetite, eating more or eating less. Also, if you're noticing changes in their interest in the activities that they used to like doing, like hanging out with their friends or playing specific sorts of games. And then along with that, also changes in academic performance for school-age children. So if you're noticing that their grades are dropping, or if they seem more emotionally labile, if they're being set off by things that didn't used to bother them in the same sort of way before. So those are things to watch out for. And I mentioned also earlier self-harming behaviors or concerns that they're having difficulty in coping. So if you're seeing any of those sorts of signs, talk to your healthcare provider. And for our littlest ones, it's really important also to continue to go to your routine childcare visits, your well child visits, because as a part of that, we do have a structure set in for developmental monitoring to check in on development and behavior as well. And if we're noticing that your child, may be struggling in a specific area, then we can act together to try to get resources in place to support them as well.
Thank you, Dr. Minhas. A follow-up question for you. What is the number one thing we should do to help get our kids through this?
Oh, that's tricky. I don't know if I can narrow it down to one. I think one of the things that we talk about most in our clinic has been making space for your own feelings as a parent or caregiver, and also for your child as well. And so again, different ages and stages will benefit from different strategies. For our littlest ones, that could be, just validating their feelings, connecting and letting them know that you understand that they're mad or sad or whatever they may be feeling. I think that really validates it and allows you to connect, because I think, for all of us, but including our children, this is the first pandemic that we're experiencing. And so letting them know that we're in this, we're experiencing this together. This is a communal experience. We're going to try to figure that out, but also giving reassurance as well, letting them know that you'll be okay, that you're going to do your best, and that you're working together as a team, as a household, I think is really important. The other thing actually that we talk about a lot is also screen time, because that's something that's really ubiquitous. Like all of us right now, we're on our screens. And I think it's important to think about the Canadian Pediatric Society recommendations pre-pandemic were to have no screen time under 2 years, up to an hour for 2 to 5 year olds, and then up to 2 hours for kids that were older than 5. And so that's really gone out the window with the pandemic, with our screens being our window to the world, with school, with being able to connect with others as well. So I think it's important to leverage and think about that screen time and how it's used. So make it active. So if there is a physical component to what they're watching, if they can be up and about with it, if it's something that's interactive and allows them rather than just to passively watch. And then also watching together as a family, I think is really important. I like to think of, trying to use screen time almost like you would use a book. So use as an opportunity to maybe pause if you're watching Netflix or whatever it might be, pause, take a moment to talk to your family about, hey, what do you think happened with that character? What do you think might happen next? And try to use them as learning opportunities as well. Because again, screens I think are so prominent in the way that we're doing things right now. And then generally also turning off screens if nobody's watching, and in at least an hour before bedtime as well. So I think from a harm reduction standpoint, that's something that I think is important for us to think about as well with our kids.
Thank you. Our next question is for Dr. Kassam. Dr. Kassam, is it okay to go to in-person office Christmas parties or holiday gatherings this year?
That's a tough question, because I know that things are moving very, very quickly as far as Omicron, and the public health experts who have all of that data in real time, who we take guidance from as far as the safety for these types of protocols, are the best physicians and experts to ask that question of. I know Dr. Moore is having a briefing later this afternoon, which is unusual typically because he has his briefings on Thursdays. And so we're waiting for more information about what he has to share with all of us before we make pronouncements about the future. But ultimately, we take our guidance from our public health experts, both at a local, provincial, and often federal level as well.
Thank you, Dr. Kassam. Our next question is for Dr. Bhattacharya. Should all of Ontario follow Kingston and impose new restrictions before Christmas and New Year's to stop the spread of the Omicron variant?
So I'm not an infectious disease expert or a public health expert, so I think obviously they are responding to the case counts and the rapid rise, but I don't know that. It's a good question. Essentially, in many cases, we've said, oh, we acted too late. And in this case, will we say the same thing? That remains to be seen. I may want to see if Dr. McGeer has thoughts on this. But I do think, as a society, when I was talking about the types of preferences, we could say, as a society, we want to act early. We want to put measures in as soon as we see things. And that's what they've done in Australia and other places. And in the last 3 waves, we actually didn't do that. We actually let things rise, and we often intervene at a later stage. Sometimes that allows people to be, see that, wow, things are getting worse, and then it's acceptable to put new measures in place. So I would defer that one, but my guess is we will probably see those measures come very soon.
Yeah, I think as Dr. Kassam has said, we're going to hear from Dr. Moore this afternoon, and we're going to follow public health measures. But I do think, as case counts rise, we're looking at what's coming forward. It's very hard to believe that we're not going to have to invoke some kind of public health restrictions. And I also think at an individual level, each of us as an individual cares about, our family, our friends, our colleagues, our community. We can also see case counts rising and spread happening. And we can also be thinking about what decisions we can make as individuals about reducing our contacts and contributing to control of transmission of Omicron. So there's public health rules, but there's also each of us as individuals thinking about how we get through this together and what we can do to help.
Thank you very much. The next question is for Dr. McGeer. Why is Omicron spreading when we have such high vaccination rates? Who is getting it and why? Who is the most vulnerable right now?
Well, the first piece of that might be just because Omicron spreads better than other viruses, because it's interesting, because we're actually doing so much better, because we have vaccines, because we have experience with this virus, it's now become much harder to measure the spread of different variants because they're all spreading under different circumstances. So how Omicron would do in a completely unvaccinated population, we really don't know. But it's spreading now because it can infect people who have had 2 doses of vaccine. So 2 doses of vaccine protect you substantially, not as well as we would like, but substantially against severe illness and death. But it doesn't protect you nearly as well against getting milder illness that you can spread to the people around you. So our problem, if you like, it's kind of not a problem. Okay, we backed off on our restrictions so that we could try to get back to normal life. We were a lot less restricted than we used to be. And that was a very good thing, okay, when we were dealing with Delta. But the price of it now is that when Omicron comes and it spreads more easily through people who have had 2 doses of vaccine, then we start to see much more rapid spread because we have released those public restrictions and allowed ourselves more contacts and I think probably a better life. And so, until we can get 3rd doses for everybody, we are going to have to go back to restricting our contacts.
Thank you very much, Dr. McGeer. Just a reminder to our media friends on this call that we are nearing the end of the session. So if you do have any questions, please get them into the Q&A box as soon as possible. With that, I'm going to move on to our next question also for Dr. McGeer. When will science know more about Omicron and whether vaccines work? Is it going to be in a week from now? Is that too late?
So I think the answer is that, every hour you're getting more information. Okay, I think it's kind of cool. We've moved from news by press release to news by Twitter. Okay, your best source of Omicron data is actually people's Twitter accounts, but it's amazing to watch. People around the world just scrambling to get data to everybody else about what we know and to tell us sort of what we need to be doing and how we can responding. So there's we have more data than we had 6 hours ago, which is more than we had 24 hours ago, which is more than we had 48 hours ago. Every day brings us different news. Makes it hard because it's really confusing. Data comes from multiple sources and sometimes it says different things and it takes a while to put it together into a coherent story. But it is moving very quickly, and that undoubtedly will be helpful to us in getting through the next 6 or 8 weeks.
Thank you very much, Dr. McGeer. Our final question is for all of our panelists. Do you have healthcare-related New Year's resolutions for yourself or policymakers?
Dr. McGeer, why don't you start, then we can go to Dr. Minhas and Dr. Bhattacharya.
I'm having real trouble believing it's the end of the year, actually. So I'm not sure I'm up to New Year's resolutions yet because I'm really thinking it's maybe September or possibly 2020 sometime.
From my standpoint, I'm thinking both as a physician, but also as a dad. And I think one thing that's become really tricky, particularly over the last year, has been work-life balance. So especially for those of us that work sometimes from home and are trying to balance various aspects of our lives. So I think that's something I'm going to be reflecting on as well. Is what does that work-life balance look like? How do I think about what work from home looks like at times as well? I mean, I think many folks out there are thinking about that in terms of wellness for themselves and then for their families as well.
For me as a dad and an individual, I think this year is going to be more outdoor time, more fresh air, more time spent in the woods, because that's what brings me peace and also helps me work better during the week. And so that's something I want to carry on and do more of. As a physician, I want to, there's been a little bit of inertia, I have to say. We got used to a certain way of working, and really now I want to start thinking about what is the new way to practice medicine, and I really want to double down on that new way of practicing. And lastly, for our leaders, I think thinking about the unprecedented partnership between science and policy, my recommendation for them is to get better at communicating uncertainty and collective decision making that will help us get behind this.
Thank you very much to all of our panelists for taking part today. This concludes our Q&A session, and thank you to the media for all of your questions. With that, I'm going to turn things back over to Dr. Kassam now for closing remarks. Dr. Kassam.
Thanks so much, everyone, and thank you to the panelists. This was a really important discussion at a very important time, in my opinion. And I know that as we're moving into the holiday season and we're thinking about loved ones, we're thinking about the new year we're making resolutions. I also want to just highlight the fact that we do have momentum. I know that this presents an unprecedented challenge yet again, but we've gone through this already. We're in a fundamentally different place. We know how to react. We know what works. And so I think we just have to focus on all of the positive learnings that have happened over the past 20 months and carry those messages and that hope into the future, because I do think that that's really going to be an important ingredient for all of our success in our mental and physical well-being. So finally, thank you everyone for attending today's briefing and for your thoughtful questions, especially to the members of the media. I hope this session was helpful in informing your reporting. It will be our last media briefing in 2021. We started this not too long ago, and I think this has been quite a successful endeavor. And so we know that we have a lot more to do, and we're going to be back in the new year with topics of interest for you and for the public. And we believe that this provides a service to everyone as far as a better understanding of what is happening on the ground. I look forward to watching and reading your coverage. And if there is a topic that you would like to hear doctors discuss in the future, please send your suggestions to media@oma.org. And thank you again for your time, and happy holidays to you and your family. Stay safe, stay healthy, get your third doses,